Good morning, Dylan Robles. I am Mihiraa. Let's start the warm-up sessions. Do you have a role model?
Yes, I do. My role model is my mother. I follow many things that my mother does. It is from my mother I learned the basics of kind behavior, decision-making, and organizing skills, a polite and humble manner, helping and sharing mentality. The care and respect she gives to everyone makes me wonder sometimes. She is a perfect example of womanhood. I believe a nurse should possess all these qualities. She is my superhero.
Which is your favorite destination? Why?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here nurses are paid well and respected too. In addition, I have many friends and relatives over there so they can help me during my initial days.
What is your career goal after reaching your dream destination?
Right now I do not have any clear management goals. I am very interested in learning about management and leadership and would be interested in any committees that I could participate in and learn. I have lots of ideas and would love to be in a brainstorming group, and I am very interested in the management dynamics of the organization. I feel that I need to join leadership groups to learn and meet new people.
What are the qualities that a nurse should possess?
Of course, a nurse should possess a variety of qualities. First of all, she should possess excellent communication skills which help them not only to gather clinical data but also to maintain an effective relationship with other team members. Secondly, problem-solving and critical thinking skills are essential for nurses to deal with emergencies and difficult situations. Other qualities such as punctuality, dedication, honesty, and competency are also pivotal for nurses.
Where do you see yourself in 5 years?
In 5 years, I envision myself as a seasoned nurse, working in a challenging and rewarding role. I aspire to deepen my clinical expertise and leadership skills and to become a valuable asset to my healthcare team. I hope to be involved in mentoring and educating new nurses and to contribute to improving patient outcomes through evidence-based practice. Ultimately, I strive to make a positive impact on the lives of my patients and their families.
Your preparation time is over. You can now start the role play.
Hello Mihiraa, it's good to see you again. I know managing your condition can be challenging, so I wanted to start by checking in on how you've been doing lately.
Oh, hello Dylan. Thank you for coming. Honestly, it's been a bit tough. The fatigue is really draining. Some days I can barely get out of bed. And the swelling in my ankles is quite uncomfortable, especially after I've been on my feet for a while. I've been trying to stick to the diet and fluid restrictions as best as I can, but it's difficult sometimes, especially when my family is having a nice meal. I also feel nauseous on and off.
I understand it must be difficult dealing with all of those symptoms. Now, Mihiraa, I'd like to talk about some of the available management options with you as it's important for you to feel comfortable with the path forward. There are several ways we can manage your condition, each with its own benefits and considerations. One option is to continue with what we call conservative management. This focuses on managing your symptoms through medications, diet, and fluid restrictions. It's about maximizing your comfort and quality of life for as long as possible. Another option is dialysis, which acts as an artificial kidney to filter waste and excess fluid from your blood. There are different types of dialysis, and we can discuss which might be the best fit for your lifestyle and preferences. Finally, there's the possibility of a kidney transplant. This can offer a more long-term solution, but it involves a careful evaluation process and being placed on a waiting list. I want to assure you that we'll explore each of these options thoroughly, answer all your questions, and make a decision together that aligns with your goals and what's most important to you. Do you have any questions or concerns, Mihiraa?
Well, I've been managing with the current treatment, but the symptoms are definitely getting worse. I'm a little apprehensive about dialysis. I've heard it can be quite time-consuming and have side effects. And the thought of a transplant is both exciting and scary. I don't know if I'd be eligible and the waiting list. I've heard it's very long. I just want to feel better and have some energy back.
I appreciate you sharing your feelings so openly, Mihiraa. It's important to remember that managing your ESRD is crucial for preventing some serious complications, such as hyperkalemia, which is a dangerous imbalance of potassium in your blood, fluid overload which can put a strain on your heart, and other cardiovascular issues. Effective management not only helps prevent these complications but also significantly improves your quality of life and can even extend your life expectancy. It's important to find a balance between managing your condition and maintaining a fulfilling life. What are your personal goals for your care, Mihiraa? What's most important to you?
I suppose my main goal is to have more energy so I can spend more time with my grandchildren. I miss being able to play with them and take them to the park. I also want to be able to do some light gardening again. I know I can't expect to be completely back to normal, but I'd like to feel well enough to enjoy life a little more.
That's a very understandable and important goal, Mihiraa. Based on your choice, let's talk about your treatment plan. This includes your medications, your dietary and fluid restrictions, and your dialysis schedule if we decide to proceed with that. It's really important that you adhere to this plan as closely as possible. Consistent adherence helps to prevent further decline in your kidney function, minimize your symptoms, and reduce the likelihood of needing to be admitted to the hospital.
I understand it's important, but it's hard sometimes. The diet is very restrictive and I sometimes give in to cravings. And remembering to take all the medications at the right times can be a challenge.
I understand it can be challenging, and we can definitely work together to find strategies that make it easier for you. Now, Mihiraa, based on everything we've discussed, I'd like to confirm that you understand and agree with the proposed management plan. This might involve continuing with your current treatment, adjusting medications, making changes to your diet and fluids, or starting dialysis if we both feel it's necessary. We will, of course, discuss any changes in detail before implementing them. Do you agree with this approach, Mihiraa?
Yes, I agree. I trust your judgment, Dylan. I want to do what's best for my health and be able to enjoy time with my family. I am ready to work with you on this.
Thank you for the consent, Mihiraa.